Hello there, Adina here, physical therapist, and I am here to share some tips with you. I had a killer massage, and this was a treat for my birthday. It was something I was supposed to be doing annually. Haven't really done that, but you know how we are. Anyway, so what I'm going to share with you is how to deal with soreness, because after you get a massage, you can have soreness. Well, I signed up for a 30-minute deep tissue massage in an area of my back that I just can't reach. I use my tools, but I just know, Adina, you have to have somebody to help you. You know, physical therapists, we need help too. And so I, invested in it, and she got way down deep into my tissue. And I am not a big person, but that elbow I know was hitting my rib cage. But anyway, the fact is that in spite of it, I did not get an inordinate amount of soreness. And there's a reason for that. And so I'm going to share with you some tips for how to decrease soreness. Okay. Tip number one is hydration, hydration, hydration. People are not understanding how important hydration is. You are 80% water, neck on up. Your brain needs water. Your body, neck on down, 70%. So when you're dealing with tissue that has been massaged and treated and what have you, you are releasing chemicals, toxins that are bound up in that tissue, lactic acid. Sometimes there's uric acid, okay? Those are byproducts of spasming. You also, when you get a massage, it's actually a muscle activity. So you can be releasing creatine, which is just a byproduct. Those things create pain. So what you want to do is get rid of that out of the tissue, which is what you're doing when you release the toxins with a massage, but you can't just let it sit there. So what's important is for that stuff to be moved out. Circulation. So that is where hydration is very important. Drinking that water is like flushing out your body, flushing out the toxins. And, you cannot wash your car in grape juice and call it clean. So you cannot wash your body in coffee, tea, and soda and think it's clean. You need water, people. That is what your body requires. And we will talk more about this. And you will know I will hammer this in because it's so critical. So hydration, hydration, hydration. That's water on the inside. So what was something else that was a part of this? They offered a steam room, which I absolutely love. I love steam rooms. I love sauna. When I go to the gym, the gym I used to go to, I would sit in both of them. And you think I like heat. I just love how you feel. It just makes your skin glow. You just feel good because you are detoxifying. So anyway, I got to do that. I just did it for 10 minutes. And I knew it was going to be beneficial. But if you don't have a steamer, a steam bath, or a sauna, then get something that will actually give you a good amount of heat in that tissue to bring fresh blood flow in to move those chemicals out. You can do that with a good heating pad. And I think I'm going to do a presentation on what a good heating pad is. The ones that you stick in the microwave that last 2 or 3 minutes is not a good heating pad. I'd rather you jump in the shower and get hot water on your body part than just put a heating pad that doesn't do anything. Well, either way, the point is increase the circulation, get some heat in that tissue to flush those toxins out. So that's water inside and that's water outside. What's another thing I did? Well, I have been taking green smoothies. Green smoothies are your friend, and they are powerful because of the magnesium content in it. It actually prevents tissues from getting sore. So when you are dealing with soreness, now let me tell you, I do treatments on patients, and I get some patients who are very, very like over the top reactive. And I know it's not normal. And I know it's not because of what I've done, because again, that lady dug her elbow in me and it was killer. But I don't have the kind of soreness that keeps me from functioning this today. So it's because of the diet that I'm taking in. And I'm not going to belabor the point, but I will tell you, these are powerful and they will do wonders for your health, wonders for your bloodstream, wonders for your body. And I make it up every morning and I've enjoyed them. And you can make them flavorful. Don't let the green taste and everything turn you off. You can make them very tasty and flavorful. And it's much better for you than, I guess, again, the coffee and the tea and the soda. So green smoothie. What was another thing? I would say that I stretched out, and that is very, very important. Okay. When you get the tissue pliable because it's been treated, then you want to help that tissue to maintain the length that has gotten gained. And so doing stretches specific to that area is very important. You want to just keep things moving, and you're going to have to retrain the tissue that, hey guys, this is the new normal. Okay. So stretching out is important as well. The other thing I would say is that I actually had her use one of my products. This is a product that I use on my patients. This is the product that I sell. And it is the Depane, and I have to adjust this so you can actually see this. So that is a product that I actually make. Restauré Botanicals is my product company. And I had her use this. She asked me if I was allergic to anything. I told her, no, not really. I said, but I can ask a favor. And so I shared it with her. I had to smell it. And most of my patients love the smell of it. It's very refreshing. But anyway, I had her use this. She warmed me up, and then she used that on the tissue. And this salve is very good for reducing pain. It feels good. Depending on what your area that you're working with, I can sometimes give you a little bit of a warming feeling, but bottom line, like I said, it really reduced the swelling, the soreness, I apologize. So that is something that I actually had her use as well. And I knew it was going to work and feel good. And so I wanted to benefit, because my patients benefit. I use it on little certain spots, like if I treat my arm or something like that. Now, the other thing I did do was after, in the nighttime, you think, okay, you're going to get sore. I'm not saying I didn't get sore at all. I just tell you, I did not get sore to the level and the degree of soreness that I should have had the intensity of the treatment. So I did rub a little bit more of, I actually tried two different things. I had sweet peppermint oil, essential oil. So I put some of that on one side. And then I actually used my other products, which is good for circulation. Oh my goodness. I'm sorry. I tried to practice this. Here we go. This is Jore. This is what I used also, just to kind of do a comparison. I wanted to see, how it worked. But this one for joints. But you can use it for muscle too. But I find that Depane is very good for muscle tissue. So anyway, that's what I applied at the end of the day. And I feel great. A little bit sore, not anything to cry about, not anything to make you feel like, lady, what did you do to me? So I just wanted to share those tips with you. And I hope you find that beneficial, because I know soreness is a big deal. And again, this is an aside, but if you are having that soreness, you have to do strengthening. And if you don't know what to do, go see a physical therapist, and find out what is the muscle that you are dealing with that's creating this soreness, and what are some of these specific exercises you can do. I mean, it's something like a bicep or your quad or something like that. I'm sure you can Google and find exercises for those areas. But understand that's very critical and important. So hopefully you have found this helpful. And I would say, I want you to make a comment on, do you have soreness, and where do you have soreness? And what are some things that you have tried that have helped? The other thing, if you can, let me know what content you would like, because I want to give you information that's going to be helpful. And for those of you who don't know me at all, I am a physical therapist, and my whole purpose is to help you to conquer your pain using natural methods. So hopefully you will take the time to let me know what else you want to learn about, because I love to teach. I just don't like doing videos, but I'm doing this for you. So I hope that you found this beneficial. Thank you.